This is committee meeting to order.
Mrs. Curran, can you please announce your presence and location for the board?
Yes, Rebecca Curran, Georgetown Township.
Thank you.
The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you may have 3 minutes to speak to the board. Would anyone like to make a public comment?
Howdy. My name is Joe Spalding. I'm from Holland Township. I would like to acknowledge the land we are on. It was stolen from Ottawa and Peoria, Anishinaabe, as well as take a minute again to acknowledge the lives lost in East Lansing, the senseless tragedy that definitely would have been prevented with common sense gun policy last week. It's a shame that this committee didn't do the same. On a less serious note, I would like to again thank Joe Moss and Ottawa Impact. Mr. Moss, hey, my guy, I'm talking to you.
Mr. Spalding, you
I'm
need
talking
to
to you.
address the chair, not individual members of the board.
If I cared what you thought, I would have written you an email.
Mr. Spalding, you need to follow the rules. You
There
need
are
to address the
appropriate
chair.
ways to, there are appropriate ways. This is not an interaction between us. There are appropriate ways to address the rules. As a chair, the appropriate way to remind the body of a rule is to wait for the speaker to finish and then remind the entire body of the rule.
Mr.
It's courteous.
Spalding,
I'm speaking to you right now. I don't know what your problem is.
you may finish.
A little bit. I would like to thank Mr. Moss for helping crash the entire Republican Party when I thought you all were just going to be crashing the county party. Thanks in no small part to Joe, the Michigan GOP is now being run by the biggest statewide loser last week in the election. My folks on the ground at the convention let me know that the 4th Congressional District was a particularly contentious demonstration of a caucus, which kind of verified my personal instinct anticipating Kalamazoo and Ottawa County Republicans would be on site at the convention. I thought y'all were just going to be breaking this county's Republican Party again, but I didn't think it'd be helping me accelerate the breakdown of the statewide GOP. Many Republicans still don't know Karamo is mentally unstable. She's on record as saying demons are real and that they're sexually transmitted diseases. She also threatened to kill her family by intentionally crashing their car while in an argument with her husband, saying, "F it, I'll kill us all." That's on court record. So I would like to thank Joe specifically for helping put that very interesting person in charge of the Michigan GOP. Anyway, that's all. Thanks.
Thank you. Does anyone else want to make public comment?
I wasn't going to, but the common sense gun laws, if you look at the cities that have the most gun laws, they have the most crime and murders. If the prosecutor in Ingham County had given that person the required mandatory sentence, he would still be in jail and not able to have gotten a gun and gone to that campus and killed all those students. So common sense gun laws, we don't need more gun laws. We need to enforce the laws we have and not take away the constitutional rights of our citizens.
Thank you. Would anyone else like to make a public comment?
Good morning, Brian High Street, Park Township. I'm here to advocate for the leaders and employees of the Ottawa County Department of Public Health and the overall health of our community. Just over a year ago, I was diagnosed with stage 3 cancer and was receiving chemotherapy. During that time, I would continue to drop off my 7-year-old son at school, who along with all the other students was wearing a mask. Each school day, he and the vast majority of Ottawa County residents wore masks without complaint. Why? Because he and others wanted to protect those around us who were most vulnerable. My son wanted to protect his grandparents, his teachers, our elderly neighbor, and yes, his own dad. He, along with millions of others, understood there are others out there who know more than we do when it comes to matters of public health and are informed of the best way to keep him, his family, and his neighbors safe and healthy. That is the role and the task of leaders and staff of the Ottawa County Health Department, folks that sacrifice aspects of their lives to protect our well-being during a global pandemic. They signed up for this and did an incredible job of informing the public and providing vaccination clinics to protect our community. And this is in addition to what they do day in and day out. They protect us, the water we drink, the food we eat, as well as diseases and infections. Not only that, but they protect those that are most vulnerable. The elderly, people with underlying conditions, people with special needs, children with compromised immune systems, etc. Their motto is not survival of the fittest. Their values are equity, integrity, and excellence. What they're not prepared for is to be verbally attacked, ridiculed, and threatened for doing their job by their very own neighbors. Folks they go to church with, pass by in grocery aisles, share parks and beaches within our beautiful county, having their and their family's safety threatened because of misinformation, dog whistles, and outright lies. The trauma this has and continues to inflict upon those on the front lines is substantial. Can you imagine being called a groomer and a pedophile by your neighbors for preventing unintended pregnancies and sexually transmitted infections? And the trauma continues with the hiring of Nate Kelly. Respected leaders have been torn down and now potentially replaced by someone who spread lies endangering the public health. Someone who proposed sending horse dewormer, neti pots, and HVAC systems to protect against COVID. Put yourself in their shoes, being part of a team who face unimaginable challenges only to see their respected and effective leaders replaced with someone who goes against science and evidence-based practices, endangering our community and putting lives at risk. In closing, I would like to say thank you to the nurses, staff, and leaders of the Ottawa County Health Department. Your expertise, compassion, dedication to protect our community is very much appreciated, especially by those who are most vulnerable to serious illness. On a personal note, I challenge you to visit the Cancer and Hematology Center of West Michigan in Holland. Meet with the hundreds of your constituents dealing with cancer and having compromised immune systems. Get to know them and listen to their pain and hope. Just one thing, it's mandatory that you wear a mask. Thank you.
Thank you. Would anyone else like to make a comment?
Ian Zimmer, Port Sheldon Township, West Olive, Michigan. Chairperson and members of the room. This is a test and only a test. Anti-mask sentiment. Masks don't work. Masks infringe on my personal right to choose. I would advocate that every hospital operating room in America be mask-free. No doctor, anesthesiologist, or operating room attendee should have to endure the psychological and physical discomfort of such stupid protocols that are worthless of merit. How many listening would be appalled if hospital mask removal were to take place? It is interesting when the thesis and antithesis change roles and subjective view and objective view blur. How can the logic have dichotomy if masks in the surgical setting promote our safety and well-being, but with COVID are useless, would seem conflicted?
Thank you. Would anyone else like to make public comment? Okay, do we have anyone online? No online comments. Okay. Next, we have the approval of the agenda. Is there a motion to approve the agenda?
So moved.
Is there a second?
Support.
Okay, so it's been moved and seconded to approve the agenda as presented. So I think we need to do a roll call vote on this.
Madam Chair, I
Yes.
just want to remind you that Commissioner Kern is online, but she cannot vote unless she is meets the various conditions under the Open Meetings Act.
Okay. All
Okay.
right.
She can participate, but she can't vote.
Okay. Thank you for reminding me of that. I think Rebecca had asked for us to do roll call so that she would know
Yes.
how we vote.
Part of the rule.
I did not request that anyone do roll call.
Okay. Thank you, Rebecca.
Part of the board rules, rule 4.6 says for teleconferencing, all votes will be by roll call vote for the benefit of the commissioners to know
Okay.
each one. So we'll just kind of go forward with that.
Sounds good.
Mr. Belknap,
Yes.
Ms. Cosby,
Yes.
Mr. Bonema,
Yes.
Mr. Moss,
Yes.
Mr. Zylstra,
Yes.
Mrs. Minema,
Yes.
Mrs. Ebel,
Yes.
Mrs. Rhodey.
Yes.
Motion passes.
Thank you. So moving on to our consent items, we have one item under our consent agenda. The approval of the proposed minutes from December 14, 2022 and the January 31, 2023 Health and Human Services Committee meetings. Does anyone wish to remove an item for discussion or consideration? Is there a motion to approve the consent items? So moved.
Support.
Okay, so it's been moved and seconded. And so we will do a roll call vote on this again.
Ms. Cosby,
Yes.
Mr. Zylstra,
Yes.
Mr. Bonema,
Yes.
Mrs. Minema,
Yes.
Mrs. Ebel,
Yes.
Mr. Belknap,
Yes.
Mr. Moss,
Yes.
Mrs. Rhodey.
Yes.
Motion passes.
So as we have no action items for this meeting, that moves us to our committee reports, where we'll receive updates from several departments. And we will begin with community mental health with Lynn Doyle.
Good morning.
Good morning.
Good morning.
So things continue to be busy at community mental health. One thing we're paying particularly attention to is the upcoming re-enrollment of Medicaid recipients. Kendra is here, Kendra's manager from DHS, and I'm sure she'll talk more about that. But our funding for Medicaid comes to us with a strong tie to Medicaid enrollment. So obviously, if those enrollments go down significantly, that's going to impact our funding. So keeping a close eye on that. I wanted to let you know that we have been notified by the Michigan Department of Health and Human Services that we have a new grant opportunity. The grant is called Boundary Spanners. It is a grant that is intended to help with diversion, deflection, and successful reintegration of individuals involved in the justice system in our jail. The grant would allow us to develop a team dedicated to coordination and support of justice involved or at-risk individuals with behavioral health conditions. Again, the goal is diversion, stabilization, and integration of individuals re-entering the community with that long-term goal of reducing recidivism rates, people coming back. The total grant award is $214,000. That's just for the first 5 months of the grant, which begins in May. We're looking at potentially hiring 3 new staff with that first award for the 5 months, a diversion liaison, which is a mental health clinician, community sports specialist, which is a mental health specialist, kind of a case manager, and then a re-entry recovery coach. So someone who has lived experience that can help people who might have substance use disorder to get back into their community without using substances again. The other grant that I wanted to talk about today is our CCBHC grant. And I've been at a couple meetings now where I've talked about this. but I thought this might be a good opportunity to go into a little bit more detail and allow you to ask questions. CCBHC stands for Certified Behavioral Health Clinic, Certified Community Behavioral Health Clinic. It is a specialty designated clinic that provides comprehensive mental health and substance use disorder services. Really a hallmark of that grant is that it's intended to allow us to serve anyone who walks through our door, regardless of their diagnosis or their ability to pay or insurance status. It's a model that is integrated. It's based on evidence-based practices. It includes things like eventually we'll be able to provide 24-hour, 7-day-a-week crisis response services and medication-assisted treatment services. Some facts about our particular CCBHC grant. It's known as an expansion grant. And the tie to the SAMHSA, Substance Use and Mental Health Services Administration, the expansion grants actually come out of that grant body, which is a federal organization. We were awarded the grant in August of 2021. It's a 2-year grant, and the ending of that particular grant will be 2023. The total grant award was $3.8 million. The grant has a very high possibility of renewal, either through the expansion grant process through SAMHSA, or else the state and many of the states in the country are going towards a state-run model, and that is called a demonstration program. Don't mean to confuse you, but the demonstration program through the state of Michigan is in its 2nd year. And the funding, instead of coming from SAMHSA and the federal government, in that way comes through the state and Michigan Department of Health and Human Services. Either way, I believe there is a very strong possibility that funding will be available either through that expansion or the demonstration program. The previous funded CCBHC programs in Michigan were all awarded a 2nd grant cycle. The various things that we have been doing with grant funding so far really have surrounded integration of mental health and physical health. We've been working on things like providing wellness and health opportunities that we have not been able to do as much of without this funding. Just some examples of what we've been working on. We're contracting with the YMCA to provide memberships. We have worked with Community Actions House Food Club to provide some membership and some training for the people that we serve to learn how to grocery shop on a budget and also eat healthy. We have been providing co-occurring support groups, mindfulness groups, cooking classes, educational opportunities on things like diabetes, obesity, and mindfulness. The reason I came to the Finance Committee previously with 8 staff, the first year of that grant, we were able to hire 14 staff, and we intentionally did not fill all the positions that we were planning on because we wanted to see where we were at in that first year of implementation. Hiring 6 more staff would have, I think, been overwhelming to the supervisor of that program. And we, again, really wanted to get a feel for the programming that we had initially started was actually impactful and where we wanted to spend the rest of our money. Much like any of the other grants that we get, if the funding were to go away for that grant, we would first of all see if there were any other funding opportunities such as additional grants. If we had any vacancies within our own organization, we would place staff there. And then as a last resort, we would lay off staff if we truly had exhausted all of our funding resources. Just a little bit about our staffing, because I think that, again, 8 new staff is a lot to ask for. With grants, they tend to be awarded suddenly with a budget of dollars that you have to spend. So we have come to the commissioners in the past with an ask of multiple staff, more than 1 or 2 at a time for our grant opportunities. The highest FTE count that we've had was back in 2014. We had 154 FTE. I explained in some previous meetings that starting in about 2014, we had some serious funding issues with our Medicaid. It was related to a re-regionalization of the CMHs. It also had to do with the Medicaid funding, the way the rates are calculated. Needless to say, we had a significant decline in our Medicaid revenues, and we ended up having to reduce our staff by about 32%. So in 2016, we went from 154 in 2014. By 2016, we had 104 staff. Our current FTE count is 129. So we're still not back up to where we were in previous years. Despite the population that we serve and the individuals that we serve has increased by about 11% since fiscal year 18. And I anticipate with what's going on right now with the requests for mental health treatment and substance use disorder treatment, that those numbers will continue to increase over the next couple of years. I will leave you with that. Do you have any questions for me?
Well, sorry. May I?
Yes.
Yeah, just reiterate those numbers. In 2014, we had 154 full-time employees equivalents.
We had 154 FTE.
And then currently we're at 109.
No, 129.
129. Okay, great. Right. Thank you very much.
You're welcome.
Ms. Cosby?
Lynn, what is your vacancy? What is the vacancy rate right now?
How many open positions do we
Correct.
have? We have, I believe we have 4. We're in the process of hiring a few people, but I believe we have 4 full FTEs vacant.
And how long have those been posted? Do you know?
They vary.
Approximately.
2 of them have been vacant for over 6 months.
And so are you hopeful with these like 8 positions that you would be able to fill all 8?
I think we will. The vacancies are for master's level professionals, social workers, master's level psychologists, and those are very scarce at the moment. I think I explained in previous meetings, there's a lot of work available right now, especially in telehealth. And so most CMHs, most mental health organizations would tell you that master's prepared social workers, psychologists, licensed professional counselors are very hard to find. The positions that we're asking for are bachelor's level, and we've had more success with attracting bachelor's level individuals.
Okay. Yes, I was just curious if you had considered, if you had a high vacancy rate, considered salary changes too, to be more competitive and reducing the number of positions posted?
I would love to do that. We work with the county on their wage scale. So we're a little bit bound by that. That wage study wasn't done too too long ago. However, I don't think it really takes into consideration what's been happening most recently with inflation. A lot of private organizations are able to offer incentive payments when you come on, retention bonuses, which we have done a little bit of here. But I think that we need to continue to look at that. Are we competitive in what we're paying? Mhm.
Thank you.
Do you have a way of helping us out with that? So that we can maybe look at some ways of reevaluating that for the county?
Sure.
I think that the low pay is a big barrier, and if that's our big barrier to serving our people, we need to really reconsider it. So if you have any way of compiling more information for us, I would love to see that.
Okay, yeah, I can look at the other CMHs that are local. I can also look at some private industry and see what they're offering.
Okay,
Happy to do that.
thank you.
Mhm.
Go ahead.
Thanks for coming in this morning, Lynn. This has been very helpful. Over the last few months, I've been meeting with different leaders in the community to get a sense of how they interact with your department. And had a lot of different stories, a lot of very positive stories, and very grateful for all the services that you work so hard to make sure are there for them. When I asked them what could be improved, like if you could just wave a magic wand and improve something, I did hear one thing, and I wanted to bring that to you this morning because the CCBHC grant seems like it's somewhat open-ended to maybe address this, and that is waiting times. And so when I visit with the schools and the officials in the schools, they talk about how when they have a student in need, in desperate need, depression, thoughts of suicide, self-harm, harming others, that a lot of times when they engage, there's a waiting list, and that waiting list is more than weeks. It can be months sometimes. And you lose that opportunity to really get in there and address the problem right then and there. And that's an incredible amount of stress on those families. Is there anything that we can do to help those families get an immediate or a faster response to get their child or their family member in front of help faster?
Absolutely. That's an excellent point. And it's definitely an issue across the board as far as mental health treatment right now. Most organizations have some kind of waiting list. According to our contract with our region and the Michigan Department of Health and Human Services, we really can't keep waiting lists. So if you qualify for a Medicaid service, we have to provide it to you. So it kind of depends on what service is being asked for. I don't know if the schools are asking specifically for CMH services, or in general, they're looking for help and being told there's a waiting list. You're absolutely right that CCBHC is intended to help mitigate that issue by responding quickly with a 24/7 crisis response, if that's what an individual needs. But it also will allow us to provide more services to more people. Now, that doesn't necessarily mean that every single person in Ottawa County who needs mental health treatment is going to be able to get it from CMH. We could not possibly ever be that big. But what we can do is spend time with those individuals right up front and figure out what it is they need. If it's truly, I'm in a crisis, I need help right now, we'll do everything we can do to try to address that issue through various programs that we have. We have a crisis team right now that operates 24/7. We're working on that mobile crisis response. And we also have navigators who can spend time with people either on the phone or in person, listening to what their need is immediately and helping them to get the resources that they need. So by all means, that's what we're trying to do, is provide service to a person when they need it and how they need it.
So you would say that if a family discovers a family member, a child who has attempted suicide, that there's resources that they can immediately engage with to help their child, that they can get response that same 24-hour period?
Yes.
Okay.
Our crisis team is operational 24 hours a day, 7 days a week. So that you can call into that crisis number. You can also get a response from us by going to the emergency room. If you need help and you have Medicaid, will come down there and assess the situation. If you have no insurance, we will help with that situation. If you have private insurance, the hospitals are going to process through your private insurance provider. But we do have 24-hour crisis response available right now. We've had that for years. And we are working on setting up those mobile crisis programs that will actually allow us to go out to a family home and intervene and respond to those individuals. And that'll be open to anyone. It doesn't matter what their insurance is and their ability to pay.
Great. Thank you for stating that for the public. I think that's on the minds of a lot of different families this time of year, especially.
Mhm.
So thank you.
Can I ask one more question?
Yes.
So just for a point of clarity here. So what you're saying is this crisis response team and then also the mobile crisis center. Or yeah, I think a unit, right? So there's no restriction on age, no restriction on their diagnoses, since we kind of bucket those, IDD, behavioral health, and substance use disorder.
Correct.
And then no restriction on payer.
Correct.
Okay.
I have to say, so we're building those teams. One of the crisis teams that we have is the crisis intervention team. It's that model that we're working with law enforcement. There's a master's level social worker and a police officer who can respond to crisis situations. Those are for anyone, any age. It doesn't matter if you have Medicaid or what payer you have. We have 2 of those teams set up right now. Looking at setting, actually 3 teams, looking at setting up a 4th team. We were trying to set that up for second shift, and that's one of those positions that we have not been able to fill. But I see that team growing and expanding. Our children's mobile service is a similar service where we'll be able to respond to children, youth, and family. We're coordinating CIT with Children's Mobile to provide as much coverage as we possibly can. So if it ends up being more of an issue related to children or families, we're setting up right now an on-call system that will allow another worker to go out and meet with the CIT team that might be responding. They'll also be able to provide a response that's not affiliated with the law enforcement. We evidence-based practice, best practice will tell you that not every family wants to contact law enforcement when they feel they're in crisis, and that crisis should be really self-defined. It's not, you have to check boxes in order to meet a crisis. So those are all programs that we're right now in the process of growing and implementing. We've got a lot of work ahead of us, but I think we're making a good start on being able to provide much more of that to our community.
I'm asking because I think this is a communication tool for you as well. So
Mhm.
as that grows and develops both programs, this would probably be a good venue for you to share.
Absolutely. Thank you.
Hey, Ms. Depot?
Thank you, Lynn.
Mhm.
I think that you're doing a good job. But I do have a question. I know you've talked about this crisis response team, the navigators, setting up mobile crisis, children mobile services. So can you, and I don't know if you can, but at this point, but can you tell us more or less how many calls you get in a 24-hour period? What's the busy, probably the holidays are the busy time, but can you kind of walk us through, a day or a week or a month of, because like Commissioner Bonema was saying that they call and there's a wait period, and I don't know we don't know all the details on that, but can you kind of walk us through how much work is really out there and why you're asking for more? And just kind of walk us through, a week, a month, I don't know, a year, or what days are the busiest, or
Sure, yeah. So we get calls for services, requests for services by people walking in, but primarily it's phone calls requesting services. Our access center is the primary point of entering our system, and they get 100 calls a day, if not more, of people requesting services. Now, some of those services might be, honestly, we sometimes get calls like, do you provide driver's ed? So we're going to try to pass those people on, right? But we also get calls from people who may have private insurance, who call us and say, listen, I need some help. I'm feeling depressed. We're going to triage those people to see if they meet requirements for our services, but we'll do everything we can to get them to the right place. So if it's a difficult situation and it's multifaceted, it might be a mental health issue, but it really also might be, a housing related issue. We'll spend some time with them sorting out what that problem is. And again, if they meet criteria for severe mental illness, substance use disorder, developmental disability, and they have Medicaid or no insurance, we'll bring them into our services. We have a huge network of other programs and providers that we work with to refer people to if it's not for our services. The other place that people can access our services is through our crisis team. And they get multiple phone calls a day. Honestly, I'll have to go back and check what our current volume is, but we get upwards of 20, 30 calls a day that might be a crisis situation where our staff has to go out to one of the local emergency rooms and help assess someone for possible inpatient hospitalization. That team and our other, our navigators and our access team can also follow up on crisis calls. Substance use disorder, the same thing. The way you access substance use disorder services is to actually go to one of the provider organizations that we contract with. So it might be, though we still authorize those services, but you can actually call or go to those programs if you want to start the process of receiving services. As far as how busy we are on a daily basis, we are incredibly busy. And that's the reason why we're requesting additional staff. At this point, our case managers are really beyond capacity. Industry standard, and by that I mean what our other CMHs within the state and within our region have much lower rates than we do as far as how many people are on caseloads. And I'm hearing from many staff that they're just having a difficult time keeping up with the volume. I would be happy to give you a report if you wanted some specific data on numbers by team or by function of what we do. I'm happy to get those for you.
oh, well, thank you. That would be very helpful.
Okay.
Any more questions? Okay, thank you. Okay, next we have Community Action Agency, Jennifer Brzezowski.
Good morning.
For a community action agency, I want to spend some time highlighting our annual fundraiser, which is our Walk for Warmth. That fundraiser supports individuals with past due utility payments. So that could be water, electric, or gas. It's a really great fundraiser. As I mentioned before, we don't receive county funding, we receive state and federal grants. So it's really important for us to have that flexible funding source in order to help our community members when needed. So I want to give some details about the event. So it is going to be held on Saturday, March 4th at 9:30 in the morning. It will be held this year at EV Construction at 86 East 6th Street in Holland. We're hopeful that the weather will cooperate and we could walk through Window on the Waterfront. It's a really beautiful location. If the weather does not cooperate, then we'll be walking on the snow melt areas near 6th Street in downtown Holland. We're doing things differently this year. We've had it a number of years in Zeeland, and we want to have more exposure this year, more fun activities. Excuse me. So we will have on site, we'll have Robinson's Popcorn selling popcorn, and they're going to be donating 20% of their sales to us, which is really, really kind of them. We'll have raffles for participants. Those were all donated to us. We'll have some shirts for donation with the Walk for Warmth theme on it. And I should shout out the theme this year was from Holland Christian High School's Larissa Bowl. So she did an excellent job. She received an entertainment gift basket that included donations from BAM Entertainment Center, as well as Celebration Cinema. So we're very thankful for those sponsors as well. I also want to thank Zeeland Robotics. The high school robotics team has supported us for several years. They aren't able to be there on March 4th, so they were kind enough to hold their own walk this past Saturday and invite other robotics teams. In addition, Freedom Village has been an excellent supporter of Walk for Warmth. Because they're not able to be there on March 4th, they're holding their own walk on March 3rd. So we're very thankful for them as well. In addition, EV Construction has been very generous to offer up their space and their time to help us out for this event. Skur Printing is donating the posters. So we'll have some posters with a theme on it that'll be placed around Holland. They're donating those to us. In addition, we'll have Lamangelo's Coffee that they are sponsoring. So we'll have that on site. And we're also hopeful to have some other goodies on site as well for those that participate. I may not have mentioned this. So if it is cold that day, we're trying to be mindful of the fact that people have small children and maybe they don't want to walk around downtown if it's really cold. So we're going to have some indoor events for kiddos this year, some ways that they can have fun, but also learn a little bit more about what we do and how we help the community. So we're really looking forward to having some events indoors for kiddos in case they don't want to walk. Any questions that I could answer?
I really appreciate coming to downtown Holland. I know it's been in Zeeland for a long time, and
Yeah,
sorry
we're
about that.
gonna miss
Commissioner.
out.
Yeah, I know your first year, now, Commissioner
Yeah,
Bonneman,
come
we're
to you.
taking it away from you, but it has been for a long time. And
Yes,
so I
it
do
has.
appreciate
Yeah,
downtown Holland getting the opportunity to walk for a warmth.
yes. Thank you. And pushing it out an hour later too, because we know people like to sleep in on Saturdays. So trying to accommodate as best as we can this year.
Yeah, they're softer over there in Holland. So
Yeah, you know how it goes.
Commissioner Needham?
Yeah, just really neat to see all the partners that are coming alongside of you. I saw the artwork that was created. Fabulous job
Yes.
to that high schooler student. And I think it was a high schooler, correct?
Yes.
Okay.
High school.
Yep.
Yes.
And so I hope it will go very well and the weather will be great for you
Thank
that
you.
day.
Yeah, we're trying to, I'm glad you mentioned the poster contest because we often don't get a lot of participants. And it did not used to come with a prize. So we've been trying to build it up as best as we can because our intent is to have the community involved as much as possible. So I think it's really cool to be able to promote high school or middle school art students as much as we can. So I think it's just a really cool piece of the event that we don't want to lose and we want it to grow year after year. Thank you. Any other questions?
Okay, I think we're good. Thank you.
Thank you.
Okay, next up, we have the Public Health Department, Adeline Hambley.
Morning.
Good morning.
It feels like I saw everybody not that long ago. So, excuse me. I wanted to have provide some more information and some background about the community health needs assessment, as that was pulled off the consent agenda at the last board meeting. So, the community health needs assessment, Healthy Ottawa, is a collaborative effort with Ottawa County Department of Public Health, nonprofit hospitals, Trinity, Holland Hospital, and Corewell, as well as other community partners. There's a statutory requirement for nonprofit hospitals to conduct a community health needs assessment under Patient Protection and Affordable Care Act, as well as IRS requirements for hospitals to complete one every 3 years. It is also a key component for the powers and duties of the local health department, as we have to use health statistics to provide for the purposes of protecting public health. Now, for over a decade, this has been a single collaborative assessment process that mutually benefits all parties. The local health department works to coordinate efforts of multiple agencies to gather data, analyze data, and generate the report. We serve as a neutral facilitator to ensure a collaborative process, and we serve as a partner for implementing the community health improvement plan. Collaborative solutions from previous process include Ottawa Food, Pathways to Better Health, and Thrive. So it requires input from persons representing broad interests to identify and define local health issues, concerns, and needs. It's used to build a plan with strategies to tackle identified priorities that must be improved in order to build a healthier community. The Healthy Ottawa Coalition determines the questions based on the acceptable methods and prescribed standards. It's not a purview of this board to review and approve the survey questions, just as it's not under your purview to tell us, dictate water sampling methods, how to complete dental cleaning, or how to complete the cause of death investigations. I believe there may be some issues with the sexual orientation and gender identity demographic questions. The importance of collection of this data. Without the data, specific healthcare needs cannot be identified. The health disparities they experience cannot be addressed, and important healthcare services cannot be delivered. These are essential questions to patient-centered care, and the questions are recommended by the National Academy of Medicine and the Joint Commission as a way to learn about which populations are being served, their quality of care, and identified needs. Providers who are informed are better able to provide care that is relevant, specific, and compassionate, and it is data that our hospital partners need. The contract was originally approved and then it was ratified by this board on January 10, and the Finance Committee recommended it unanimously on the 7th to the full board for approval. And again, the Ottawa County Department of Public Health acts as a coordinator and serves as a fiduciary for this project. Those funds that are coming in are at the request, pardon me, are from Trinity, Holland, and Corewell, and are passed through to pay for the services to do the community health needs assessment. To reiterate, though the survey is voluntary and adults only, it is a requirement for hospitals that this process continues to move forward, and will do so with or without us at the table. However, we will be in breach of contract that I believe will be damage to the credibility of Ottawa County moving forward by failing to pass and continue moving this on. So that's what I wanted to talk about, as that was pulled. And I think that needs to be approved and moved on. So.
Okay, any questions? All right, thank you. Thanks. All right, next up, we have the Department of Health and Human Services, Kendra Spanger.
Good morning. All right, just a couple of quick updates and reminders from the Michigan Department of Health and Human Services. First reminder, as I mentioned last month, the FAP extra allotments due to the pandemic will be ending this month. So I believe it's this week will be the last time that individuals will receive that extra COVID funding for those that are eligible for food assistance. So it will go back to their normal amount starting in March. So we'll see the impacts of that moving forward. Next, as of March 27th, so coming up rather soon, we will be implementing what's called the IVR in contact system. Here in Ottawa, we had decided about 7.5 years ago to create our own client connect center, which means that when individuals call that are on assistance programs, that they get their phone call answered and they're not having to leave voicemails for their caseworker. Again, we had set that up quite a few years ago. So we are one of the last counties to be implementing this in contact system, which is very similar. The difference is that the system will be available 24/7. So when individuals call, just like when you call for, let's say, a credit card or utility company, you receive an automated system. So individuals will receive an automated system to get some of their questions answered through the automation. And then the actual customer service will be available from 9 to 3. Whereas right now it's available from 8 to 4. So that will be shrunk a little bit, but we're hoping with the IVR system that they'll be able to get most of their questions answered during that as well. So that will be starting, like I said, March 27th. So coming up shortly. To piggyback on what Lynn had talked about with Medicaid redeterminations and the impact that they'll have for the county. Yes, Medicaid redeterminations will be starting in April. I know I mentioned that last month as well, but thought I would just provide some data that again might be helpful for planning purposes. As of January, our Medicaid numbers were 37,595 for what's called straight Medicaid or Medicaid assisted programs. And then we had 16,278 on Healthy Michigan programs. And I think the best way to try and figure out what the impacts will be with redeterminations is going to be based on looking at our data pre-COVID, when individuals were continuing their eligibility process, whereas that eligibility process ended in April 2020. So looking at March data from 2020, we had 27,844 individuals on Medicaid, so about a $10,000 individual difference. And then for Healthy Michigan, we were at 88,758, so almost double is where we are currently. So hopefully that will provide a little bit of context. I also wanted to hand out, starting April 1st, our annual income limit and monthly income limit for all of our Medicaid programs will be updated. So I will pass these out. At the top of the grid is the name of our programs. I don't think that's anything that we need to go into detail with, but just provide you a snapshot of the eligibility criteria based on income. And again, the one side is annual and the other side is monthly, so you can have that information. With those redeterminations, basically what that means is individuals that would have been scheduled for a redetermination in April 2020 will now be rolled up to April 2023, and then May, June, July, et cetera, et cetera. So individuals will not fall off the system all at once. It's based on their prior redetermination date, which basically means reassessing their eligibility. So over the pandemic, there was no reassessments for Medicaid, only for our other programs. So for some, there may be no impact. You know, they may have been on Medicaid and didn't even know they were still on Medicaid. And so it may not be a big impact to them. But our biggest thing, and I'm sure you're hearing it on radio, social media, and other advertisements, is to ensure that our clients are keeping their address up to date. So when their redetermination notices go out, they're actually getting them and responding back to ensure if they're supposed to maintain on Medicaid or feel they're still eligible, that they're able to do so. And then just wanted a couple other updates since they're local. First, we solidified a MOU with LAUP, Latin Americans United for Progress. So we will be starting to be at their location 3 hours a week with our migrant staff. So very excited about that partnership and be able to meet clients out in the community. And then on the other side of our office, the child welfare side, our Michigan Foster Care Portal did go live, which is mifostercare.michigan spelled out .gov. So that is a new website for individuals that are interested in becoming foster parents. They don't need to be calling or contacting agencies directly anymore. They can make those inquiries online. And then lastly, as I'm sure you have heard, the governor did unveil her budget. For us locally, some of the things that we're looking forward to is, if it is passed, an increase in funds for our foster families, both for their daily rate and other needs. Also, increased funding for respite care, which is definitely a huge need for our families as well. And then there's money included for our new cloud-based child welfare system, which we are currently working on for child welfare licensing. And that was implemented. We're moving on to the next modules. So that is what I have for the department. Any questions?
Mr.
Yeah,
Zazka?
just looking at the Medicaid redeterminations. So there's about an 18,000 gap between pre-COVID and where we are now, doing straight and Healthy Michigan. Do we really think that 18,000, we're gonna go back to that level? So 18,000 folks will lose insurance? I mean, there's a possibility we could go back to pre-COVID levels as far as insurance.
Correct.
And then when you talk about just the advertising efforts, that's both a state and a county, and how much we're not doing our own work on that? It's all state efforts.
Correct.
Are we prevented from doing county work on?
I think the biggest thing would be sharing the information you're seeing come out from the Michigan Department of Health and Human Services. So there's a lot of social media campaigns specifically from the department. I would highly recommend that the county snag some of those. I'm sure the health department and CMH are probably piggybacking on some of that because it does impact our local community. So yeah, I would say the more that the information and the word can get out, the better.
Okay, thank you very much. Appreciate it.
Yeah, you're welcome. Okay, thank you.
Thank you.
Can I just ask a question?
Oh,
too?
sure.
That's okay. Can you just give us a little more information about respite care? Like, who is that available to? And how would people access that?
Yeah, so there's two different types of respite care, and I know Lynn probably could share a little bit more on what's available out to the community, but our specific respite care is only for our foster homes and for our relative care providers. So they'd have to request that through their caseworker.
Okay, so in agency.
Correct.
Type stuff. Okay. And then with the foster care licensing changes, where you said they're now going to be starting out online and not directly contacting agencies.
It can be either way.
Okay. So who follows up with them if they do start that process online? What would they be expecting?
Yep. So the inquiries actually go through what's called our FEC, which is the Family Enrichment Center. And as the inquiries come in, they disperse them out to the agencies that have availability. So,
okay. Thank you.
You're welcome.
All right. Thanks.
Thank you.
Okay. So this is now our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board.
Howdy, my name is Joe Spalding. I'm from Holland Township. I'm here to actually talk about freedom. It's pathetic and dumb that any of you think equity is opposed to freedom unless it's the county helping provide equity for the hearing or vision impaired, or the state subsidizing your homeownership. Joe over here personally benefited from county vision and hearing testing services. Lucy Ebel and every homeowner benefits from Prop A. So of course, those are all great to you. After all, to you, freedom is the freedom to tell others what to do and the freedom from being told what to do, as we saw very clearly early this morning with Sylvia Rohde's behavior. It's a tyrant's mentality, but every commissioner, barring Bergman and his bow tie, lacked the charisma for successful tyranny, and we're lucky that Roger lacks the will. We're already forcing county employees who need diversity training to maintain licenses in order to obtain them on their own time and dime, even when the licenses are needed to perform their jobs. That's the opposite of freedom, and Mr. Gibbs knows that. People who trust that Ottawa Impact clowns understand, let alone support freedom, are fools. I've forgotten more about freedom before graduating from West Ottawa High School than Joe Moss and his quiver of brothers have known their entire lives. I'm a descendant of Robert the Bruce. I'm from a line of fur trappers, moonshiners, and cannabis growers. And I'm assuring the people of Ottawa County that freedom isn't opposed by diversity. It's opposed by boring jerks who won't stop telling you how much their thoroughly nationalist asses love freedom. Finally, Gibbs said he wanted to know which employees were volunteering at a college event, but he didn't give an FUCK if they were on county time or not. It actually means a great deal, and that statement is a breach of his responsibility to the county. As reasonable people see it, potentially exposes taxpayers to a stack of lawsuits. Saying public comment shouldn't be available to be read by the public, but Mr. Gibbs should know where county employees are volunteering isn't letting freedom ring. As a taxpayer, I want Mr. Gibbs to know he had better find a way to give an FUCK and to give it fast.
Thank you. Does anybody else wish to speak? Good morning.
Amy Bade, Park Township. I'm a retired college professor and a retired licensed psychologist. Couple of points. I'd like to ask you to continue to support the retaining health director. I believe that the applicant in process does not have the experience or the scientific base to do the job. It is a poor choice for a growing and diverse county. I do not support censoring or eliminating services of public health, specifically reproductive health. The health department belongs on college campuses, and here's why. I taught human sexuality at a local Christian conservative school for many years. I'm retired from that position now. The students that I taught were college students, juniors and seniors. It was probably one of the more popular classes on campus. Not for what you think, but for the fact that we supplied accurate information. These students, these young adults are starving. They are starving for information about their bodies, about relationships, about how to protect themselves, about how to stay healthy. I ask that you do not turn any ideas about sex ed or public knowledge into something dirty, tawdry, and something to sneer about. Please, these kids have access to all kinds of information on the internet. There's all kinds of bad stuff out there, and they need ways, education, and information to be able to challenge that and to make the right decision. So then finally, in following up with Joe, let freedom ring seems like an oxymoron to me when you are blocking information and blocking important services to all the members of our community. Thank you for listening.
Thank you. Would anyone else like to speak?
Thank you. I'm Harvey Nickel, live in Jenison. I want to just give a little story. Back in June of 21, when I first started to come to the meetings because I was upset about what was happening in our county, I listened to a presentation, a very well polished presentation by the health department, showing how because of the vaccine that was introduced that year and 6 months into it, how dramatically the cases have dropped. And the vaccine was doing so well that everybody should really go out and get the vaccine. Now, what they did not tell the people is that the day that Biden was inaugurated, they dropped the cycle threshold from 45 down to 24. Now, that may not make a lot of sense. Remember, I spent 45 years teaching biochemistry. And so you have to sort of understand what the PCR is about. Now, this is a test based upon a technique created by Kary Mullis. He received the Nobel Prize for this technique. It's an amazing technique. It can take one molecule of a nucleic acid DNA and create as many as you want, because every time it cycles, it's like 2 raised to that power. And so it's primarily, he created it to create multiple or a sizable amount of material to do experiments on. He did not create it for a test. That was modified and by Fauci wanting to test for HIV. What you do for the test is that if it's an RNA virus, you have to reverse transcriptase that into a DNA, actually it'll be a hybrid at first, and then the enzymes that will then reproduce this can only go in one direction. So there has to be, quote, primers that attach to give a starting point. Now those primers, they don't necessarily have to bind 100% fidelity. In fact, the technique I use in research, which is called site-directed mutagenesis, takes that into account that up to 80% fidelity will allow primer to bind. Now the PCR test then is a result of a fluorescent molecule being produced as those molecules are being polymerized. It does not have anything to do with what is being made. It's just that it's being done. Okay, the primers used for the PCR test are not specific for what makes COVID SARS-CoV-2. They're actually based on the nucleocapsid molecule, which is common. So the PCR test can give a lot of different positive tests for things like the flu. Has anybody questioned why the deaths from flu decreased 97% during the pandemic? Because they counted them all as COVID deaths. As far as cycles, I did a little calculation. My time up? Oh, shoot. Just the numbers. What I'm talking about, they did not tell the people that this is the number of cycles. If you do a cycle 20 times from one molecule, you get 1 million copies. 24, you get 16 million.
Harvey, I'm sorry, your time's up. You can email it. Thank you. Okay, are there any other public comments? Is anybody online? Oh, I'm sorry, we have one more.
Dan Zimmer, Port Sheldon Township, West Olive, Michigan, chairperson and members of the room. The expression, "I am Christian," what does it encompass? I know Christians who smoke and those who don't. I know Christians who are salt of the earth humble and those who are not. I know Christians who are highly educated and those who are not. The comparisons can continue to infinity. As the continuum of divergence grows, what is the tipping point of inclusion and exclusion? The same applies to the continuum of political beliefs. On one end are the swastika tattooed white supremacists, Proud Boys, QAnon, running the gambit down to the everyday commoner. Humans tend to operate with an activating occurrence or event that is filtered through a belief system that yields consequential feelings that result in decisive or reactive behavior. It is that decisive reactive behavior that has divided the community. Dana Nessel determined the Open Meetings Act was not violated, but the spirit of the act was. She went on to say the board's actions are unethical and raise concerns for government transparency and will propose amending the Opens Meeting Act. Hindsight is 2020. With a degree of forethought, many see a minefield of lawsuits. Plaintiffs will win or lose on merits of their case. The only party positioned for windfall gain is common law. In the 1990s, Bill Clinton asked what the meaning of is. In like fashion, Auto Impact used the wording of the Open Meetings Act to skirt transparency and ramrod an agenda. Your agenda. This comes as no surprise. Make America Great Again is all about by any means necessary. By gunpowder and lead as seen in Washington DC, January 6, 2021. Or the Ottawa County stunt, January 5, 2023.
Thank you. Any other comments? Okay, seeing none, I would entertain a motion to adjourn the January meeting of the HHS committee.
So moved.
Support.
We have a- Okay, so meeting adjourned. Thank you. Yeah, we'll take a 10-minute break.
Break, do you want to take 5 or